welcome, and thank you for coming. What you're going to witness today is the beginning of innovation in action, and we're here to celebrate innovation in action. And in fact, we're making healthcare history in Canada today. I have a quote here. I like to bring quotes to meetings. French author R. Mallet said, "Good ideas have no age, they have only a future." And that's what we have here today. A good idea and the future coming together. A clinical pharmacy traditionally exists inside a large city-based hospital. Today, this groundbreaking development puts clinical pharmacy into rural, small-town Canada. Feng's new clinic will provide clinical pharmacy services to the doctors, nurses, and pharmacists of Huron, Perth, and Bruce and Grey counties. Gateway is the venue and structure that assists local healthcare providers to do meaningful healthcare research in their own backyard. And it's the conduit that connects rural health and healthcare issues with world-class individuals from world-class universities and other institutions. We are the portal that brings researchers to Seaforth and Huron County. The issues they explore here and the data they gather here is delivered back to the world. We strive to make this community in this area the Canadian Research Lab for rural healthcare issues. With Feng, her students, and the research team we are building, we are becoming world-class. This summer, Feng has 11 university students associated with Gateway and HealthKick working in this community. We are delivering youth to rural. While the rest of rural Ontario is watching its young people go down the road forever, we're bringing the best back here. So I hope that while you're here and while you're over at Bridges having a bite to eat afterwards, that you will take the opportunity to meet a very fine group of students who have been a great assist to us already this summer getting ready for this event. Gateway and HealthKick are just two of Glenn Devereaux's great ideas. And with the support of the Municipality of Huron East, the Huron East Community Trust, County of Huron, Marcy McCall McBain, the local golf club and local community, Carl Mitchell, and many others who pitched in along the way, we are building a great concept. So I will turn it over to Gwen now to bring greetings. She is the president of Gateway.
Well, I have to say Dan did an incredible job of welcoming you and introducing our concept today. For those of you understanding Gateway is difficult, and then we decide to open a clinic on top of that. So it becomes great confusion, and it's a delight for me to welcome all of you on behalf of the board of directors to this celebration today. You are witnessing the opening of the first rural clinical pharmacy outside a city-based teaching hospital. And we are very proud to be part of such an exciting organization as Gateway, bringing the rural communities research and teaching not possible in the counties of Huron, Perth, Grey, and Bruce without the great investment made by the University of Waterloo School of Pharmacy. And Dr. Chang is our chair of rural pharmacy. She's been asked now. And she is joining right behind her 5 more chairs that will be announced that I'm very excited about announcing. So she is in a very elite group, and she's a very, very bright star. I cannot tell you when Dan, I remember the Jake breaks at the opening, so I'm really glad we have a microphone because wait till Tim Hortons opens. When Feng keeps sending these emails, please welcome so-and-so and so-and-so and so-and-so. So at yesterday's count, I thought we had 7 students. Today I hear 9. Dan, were you up to 12? 11? So I have lost track, but we have somewhere between 15 and 20 students employed for the summer between Gateway and Health Tech. So I agree with Dan. We are bringing a lot of rural youth, and with them, the bright minds, bringing new innovation to our region. And we're delighted to reap the healthcare benefits right here, right now, and in our future. So as a community person, I take great pride today in this accomplishment. So thank you all for coming, and I look forward to seeing you all out in Freedom.
So, thanks, Glenn. So Bill Strong, are you ready to go? Bill's here to bring greetings on behalf of Ben Lobb, the MP for Huron-Bruce.
Thanks very much, and good afternoon, everyone. It's a pleasure to be here this afternoon and represent Ben. He would like to have been here, but unfortunately, other duties took him away. I do bring greetings from Ben, the Government of Canada, and certainly the foresight that the executive and directors of this organization have demonstrated is what an asset to the community. As you mentioned earlier, the rest of Ontario is sort of watching what's happening here in Seaforth and Huron County, and that is, all the credit goes to Gwen and your staff and all those on your committee. It's great to be a part of this day because it's special not only to the people of the area, but present people, but the future as well. And once again, thanks for the invitation. On Ben's behalf, congratulations, and have a good meeting.
Thanks very much. Thompson, our MPP for Huron-Bruce. We appreciate you being here in person. Thank you.
You're very welcome, and it is indeed a pleasure to be here, and it is exciting. I have to tell you, I started off my day today in Owen Sound with Dr. Hazel Lynn, and it just seems fitting that I'm here this afternoon. And I met with Dan and Gwen earlier this winter to be introduced to the whole concept of Gateway. And Dr. Chang, I got excited that day, and I'm just as excited today because we want to thank you for recognizing that there's so much to offer in rural Ontario, specifically Huron County. And we give you a heartfelt welcome and a guarantee that we're going to be here to help you realize the potential that with your students and yourself and the University of Waterloo behind you and the great team at Gateway, there's so much potential to be realized. And it just goes to prove that rural Ontario, Huron-Bruce matters. And so it's a pleasure to be here, and it's great to see folks out from the local community. And I look forward to seeing where this goes and to support you all the way along. Thank you so much.
To ask Bernie McClellan now. Bernie is the mayor of Huron East and the warden of Huron County. I'll say a few words.
Thank you very much. Actually, I guess this goes back quite a ways for me. I was not part of the original group that went down to Hazard County to actually find out about the whole project and what the concept was when it started. But I'll tell you, they came back to the council at Huron East here, and they had quite a sales pitch and quite a story of what rural health research could actually do in a rural area and how it could grow a community. And I know our council bought into it, and we wanted to be part of this project. They also then wanted to make a sales pitch to the county. I helped make that sales pitch when we went up there. The county donated $500,000 originally to this project because the county certainly recognized that rural health research was something that we wanted to invest in. Everybody is going to use it at some point, and we could see that this was really the future, and it was certainly going to help the county, the municipality, everybody in the long run. And I'll tell you, anybody that knows me knows that I always complain about the speed of politics. And this is unfortunately just another example because Gateway has been around for quite a while, or certainly trying to get established. And I got invited to a few meetings last year, and I went to one of the meetings, and I said I had just brokered a deal with the hospital trust that they were going to basically give 33 of their acres that they had out by the hospital back to the municipality, which the municipality would have the right to allow Gateway to expand their operations, whether it be for schools, teaching centers, whatever. And that came with a round of applause, and I felt like a hero. it's taken a year just to negotiate where the access had to be for the property. So politics doesn't move near as fast as we want to. So we've spent a year just to get that first part of it done, and I'm going to have to talk to Lisa after this, because now it's back in the province's hand. Because now we've got to get the Minister of Health to agree that this is actually a good thing to move forward. So we need their approval to actually do this transfer. But I hope with all these agencies and parties working together, that everybody's going to recognize that we've got a worthwhile project here, and this is something that's going to benefit everybody. Thank you very much.
Now I'd invite Mary Stanley. Mary has the longest title of anyone speaking today. She is the Associate Director, Development and Alumni Affairs at the School of Pharmacy, University of Waterloo.
Hopefully I won't have the longest talk. I'm delighted to be here today to represent the University of Waterloo and the School of Pharmacy. Our involvement with Gateway is truly a perfect fit. The university has always valued a close relationship with the community and our industry partners. In fact, our university 55 years ago was founded by a group of businessmen in the KW area who needed to bring in some additional engineers and actuarials into the area. So they banded together, and with that can-do spirit, eventually created a university. That same spirit continued when the School of Pharmacy was created in 2008. The region needed to bring in more healthcare professionals into the area, and the City of Kitchener was interested in revitalizing its downtown core. And so a very diverse group of people got together, and the School of Pharmacy was created. The City of Kitchener donated 8 acres of land, as well as $30 million to help create the program and build our building. And it's quite a lovely building if anybody is ever able to visit downtown Kitchener. It's floral panels that is very distinctive, and it actually has been acknowledged as one of the most distinctive buildings built in Ontario in the last 10 years. So we're very proud of it. We're also very proud of our school, and it goes well beyond our building. Our founding director, Jake Thiessen, established a bold vision for the school. This is the first school of pharmacy that's been built in Canada in 20 years. He wanted our graduates to be great citizens with a broad view, great Canadians, and great pharmacists. And as a new school, we had the opportunity to build a curriculum that was informed by current healthcare needs and issues and future healthcare needs and issues rather than past issues. Waterloo Pharmacy is the first co-op pharmacy program in Canada. Co-op is the cornerstone of the experiential education that our students receive. In fact, they spend a total of 16 months out in the community, and they've been involved in this community: hospital, pharmacy, family health care teams, long-term care, pharmaceutical, and the pharmaceutical industry. We're able to offer our students a diverse range of experiences that are unmatched in any other pharmacy program, really throughout North America. Currently, we pretty much are at capacity for the undergraduate school. We are close to 120 students per year. It's a 4-year program, so we have about 480 students in the program. We have a growing graduate program with about 30 faculty and 20 staff. Many of our bright young students come to us from southwestern Ontario, and a number from small communities, and that's very important. We also have very gifted young faculty, many who have created novel partnerships and are doing some very innovative research. Dr. Feng Chang is one of our shining stars, and her students, along with other healthcare professionals in this area, have already been doing some very interesting research. And I know, just chatting with her on some possible projects, she has a whole list of projects that she'd like to undertake. We just need to find some more bodies and more hours in the day, I think. Finally, I come back to my original point that the partnership with Gateway and the School of Pharmacy is really a perfect fit. We're very proud to be part of this and very excited about the future. This important partnership will truly help to improve the quality of life of rural residents. Thank you.
Thank you. Thank you all so much for being here, and especially the kind words that have preceded me. I feel like I don't quite know what to say now, but I will give you a bit of sort of the inspiration behind this. So for those of you who don't know me, I'm in academia now, but I actually started out as a clinician. I have been a clinician for most of my career up until, thanks, most of my career up until coming to the University of Waterloo, actually. So I've been a pharmacist in the hospitals, I've been a pharmacist in the community, and I've been a specialist, I've been a consultant, etc. And I'll just tell you one very quick story about the types of things that brought me to here today. This is a true story of a lady I know. She's in her early 60s, or she was in her early 60s when this happened just a few years ago. And she was completely healthy and never had any medications, didn't have any conditions, or was very active in the community, always went out and walked to the mall and did all sorts of things like that. So she, in her early 60s, she retired, and she went to her family physician, and the family physician said, well, guess what, your blood pressure is a little bit high, so let's try a medication. So within the span of about a couple of weeks, she had gone to see her physician 5 times. She went to Emerge. She got a cardiac consultant specialist consultation appointment, and she had a follow-up appointment. And she had about 4 or 5 bottles of medication sitting in her cupboard that weren't being used. So what happened was the first time she went, she got Norvasc, which is actually a very commonly used blood pressure agent. And she got a condition called reflexive tachycardia, which just means your heart speeds up. It's a side effect from the medication. But you can imagine for someone who's always been healthy, that really scared her. Right? So she went to Emerge, and of course they dutifully sent her to the cardiac specialist for all the follow-ups and EKG, etc., etc. She went back, she got her medication changed to a beta blocker, which slows her heart down. And then it dropped below 50. She felt miserable. She went back again. They gave her a water pill, but by this time she was so anxious that the doctor thought it wasn't enough. So she got put on second medication, and she got put on an ACE inhibitor, which caused, again, a common side effect, which is like a dry cough that she was uncomfortable with. So that led to her 5th visit, and she was finally put on an ARB, which is like a class of medication that she used as an alternative to ACE inhibitors. So the point of the story is she to date remains on both, but she was quite exasperated by this whole experience with the medication use and the healthcare system, and you could easily see someone like her not wanting to take the medications as a result. And that leads to a whole other series of issues. I guess my point is just that from these stories like this, you realize how much medications impact our quality of life as well as the healthcare system in terms of burden and cost. And this is all in a patient who was previously very healthy and actually was completely adherent to whatever the doctor told her to do. So imagine if it's people who are on like 8 or 9 medications to start with, and who have 3 or 4 medical conditions to begin with. It's not an easy thing to navigate, and with the guidelines, the way that current best practice guidelines are all promoting multimodal approaches, which is actually rightly so, but what that leads to is a very complex regimen. And what we're trying to do here is essentially bring a higher level of clinical services out to the community, to detach pharmacists from the boundaries of the dispensary, to offer the community, the patients, and the clinicians more choices, more options, and more flexibility. So they can have some one-on-one appointment time, they can have more time, and there's more options for them to choose from, giving them more attention and some one-on-one understanding of their own issues, so that every therapeutic plan, every treatment plan becomes customized to the individual. And that's what we're hoping to accomplish with this. We're hosting an open house throughout the next week, so I hope you will share the word and ask people to pop by. if people want to talk to us, we operate on an appointment basis because we're just unable to be here all the time right now, but we certainly hope to expand as time goes on. So if you feel free to recommend people to come by and talk to us. But looking around here today, I realized that none of this could have happened without the amazing support from the community, Gateway, School of Pharmacy, and certainly my amazing team over there today. They've done all the work in putting this together along with help from Gateway. This summer we actually have students from 4 universities. So we have students from the universities of Waterloo, Toronto, McGill, and Western. And we have students from nutrition, kinesiology, pharmacy, health systems, and we even have computer science and science with us. So I think it speaks a lot to what Gateway's mandate is in terms of what we're trying to do. And people have a say in following on dance moves and throwing on Cody's here. People say that a journey of 1,000 miles starts with one step. And I'm just truly honored and grateful that you're here to witness the start of this first step. And I hope that we will have many more to come. So thank you very much.
Videographers and camera people, are you all set? All right, then. So, shall I just count it down then? Okay, 3. Everybody ready? 3, 2, 1, cut. Great. Thank you very much. Pause all around. That brings to a conclusion our happenings here this afternoon.